Hello everyone and welcome to our video that we will be discussing the different types of depression. Depression is a complex mental health condition that affects millions of people worldwide. According to the World Health Organization, depression is the leading cause of disability worldwide, and can affect anyone, regardless of age, gender, or background. However, not all depressions are the same. In this video, we will be discussing the different types of depression according to the ICD-11. Before this, we invite you to take a moment and hit that like button, as well as subscribe to our channel for more great videos. We put a lot of time and effort into creating content that we think you'll love, so your support means the world to us. Depressive episode. The first type of depression we will discuss is a depressive episode. This is a type of depression that is characterized by a period of at least 2 weeks of low mood and/or loss of interest or pleasure in almost all activities. This is accompanied by other symptoms such as fatigue, insomnia or hypersomnia, feelings of worthlessness or guilt, and difficulty concentrating. Depressive episodes can occur as a result of a stressful life event, such as the loss of a loved one, financial problems, or relationship issues. However, they can also occur without an apparent trigger. Recurrent depressive disorder. The second type of depression is recurrent depressive disorder, also known as recurrent depression, is a type of depression that involves 2 or more episodes of major depressive disorder separated by at least 2 months without symptoms. The symptoms of a recurrent depressive episode are similar to those of a depressive episode and can include feelings of sadness, hopelessness, and worthlessness, as well as changes in appetite, sleep, and energy levels. Recurrent depressive disorder is a chronic condition that can have a significant impact on a person's life. Factors that may contribute to recurrent depressive disorder include genetics, environmental factors, and life events. People with a family history of depression are more likely to develop recurrent depressive disorder, and stressful life events, such as the loss of a loved one, a job loss, or a divorce, can trigger an episode. Persistent depressive disorder. The third type of depression is persistent depressive disorder, also known as dysthymia. Is a type of depression that is characterized by a persistent low mood that lasts for at least 2 years. The symptoms of persistent depressive disorder are similar to those of a major depressive episode but are generally less severe. People with persistent depressive disorder may experience periods of feeling better, but these periods are typically short-lived and do not completely resolve the symptoms. People with a family history of depression are more likely to develop persistent depressive disorder, and stressful life events, such as trauma, abuse, or chronic illness, can trigger or exacerbate symptoms. Premenstrual dysphoric disorder. The fourth type of depression we will discuss is premenstrual dysphoric disorder. Premenstrual dysphoric disorder, PMDD, is a type of mood disorder that affects some women during their menstrual cycle. It is characterized by severe and disruptive mood symptoms that occur during the premenstrual phase of the menstrual cycle and improve shortly after the onset of menstruation. PMDD is a more severe form of premenstrual syndrome, PMS, which affects up to 75% of menstruating women. The exact causes of PMDD are not well understood, but it is believed to be related to the hormonal changes that occur during the menstrual cycle. The levels of estrogen and progesterone in the body fluctuate during the menstrual cycle, which can affect brain chemistry and lead to mood symptoms in some women. Other specified depressive disorder. The fifth type of depression is other specified depressive disorder. Other specified depressive disorder, OSDD, is a type of depression that does not meet the full criteria for any of the other types of depression listed in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. Unlike some other types of depression, OSDD does not have a specific duration or pattern of symptoms. The causes of OSDD are not well understood and may vary from person to person. Some people may develop OSDD as a result of a stressful life event, while others may have a genetic predisposition to depression. Unspecified depressive disorder. The final type of depression we will discuss is unspecified depressive disorder. This category includes types of depression where there is insufficient information to make a more specific diagnosis. UDD is a diagnosis of exclusion, which means that it is used when a person is experiencing depressive symptoms but does not meet the specific criteria for any other type of depression. It is important to note that depression is a complex condition, and not all cases fit neatly into one of these categories. In conclusion, it is important to understand the different types of depression in order to receive an accurate diagnosis and appropriate treatment. A proper diagnosis of depression requires a thorough evaluation by a qualified mental health professional. They can help you determine if you are experiencing depression and recommend appropriate treatment options. Have any of you watching this video experienced feelings of depression like what's being discussed here? If so, please feel free to share your experiences in the comments below. And if you haven't already, make sure to hit that subscribe button and turn on notifications for my channel. I'll be posting more content like this, and I don't want you to miss out. Thanks again for watching, and I'll see you in the next video. Wanna be power.